Good morning, everybody, and thank you for joining us today. We're here with two wonderful people. Susan Cripps, who's the director of the SHINE program out of Elder Services of Merrimack Valley. And SHINE has a new twist to the name. In the past, it has been Serving Health Information Needs of Elders, but I have just recently learned that that has changed to Serving Health Information to Everybody on Medicare.
Serving the health insurance needs of everyone on Medicare.
Well, that was close enough.
Yeah, it was.
You get the point. Today we are also going to be televising this because we feel that any questions you may have, other people may have, and it's an opportunity for everyone to learn what the changes are in Medicare. We also have with us today Marcia Miller, who is our SHINE counselor, and she is here on Wednesdays. And during the sign-up period, she is here most of the day, except we do allow her to eat lunch. So if you have not signed up, we're pretty full, but there are other places we can connect you with as well. But don't wait until the sign-up. I just want to get this word out. You can come in at any time throughout the year if you have any questions. You don't have to wait until the very last minute where the changes are announced. So if you have any questions, never hesitate to make an appointment. We'll make sure that we can get you in. Marcia may not have the answer, but she knows who to go to for the answer. And it's a great opportunity for you not to be left worried about things. So make sure that you come in throughout the year, not just at the last minute. So without further ado, I'm going to pass this on to Marcia for your questions, and take it away.
Oh, thank you, Laura. Thank you. It's nice to be here in Merrimack on a nice sunny day, even though it's really crisp outside. But today is for a very important day, not only for me to be here, but a very important day tonight in Boston at Fenway Park. So we'll all acknowledge the Red Sox and wish them well. I never thought in my lifetime I would perhaps see 3 World Series wins, but we're fortunate to be living in a time like this, and it will be a good ride anyhow with all those games. So, as Laura said, we are with the Serving the Health Insurance Needs of Everyone on Medicare. And one of the first things I wanted to talk to you about today, it's because it's on so many people are questioning about the Affordable Health Care Act, the exchanges, some people might say Obamacare. Now, one of the first flyers on the table addresses this. So I'm going to ask a question, and I'd like to see hands. If you're on Medicare, then you know what? You are not eligible for Obamacare, and you don't need to do anything. How's that? Okay, is that clear? So I've tried it other ways, and I found this is the best way. Just to let you know, if you're on Medicare, you're not eligible for this. If anyone calls you on the phone and says, you know what, you're going to lose your Medicare because of Obamacare or the Affordable Health Care Act, I can sign you up, I'll just need your checking account number, your Medicare number, your Social Security, hang up on them. Or if you have a whistle right next to the phone, just blow the whistle into the phone and get rid of them. Because there's lots of scammers out there, and they're very creative. I wish they'd put as much creativity into good things instead of bad things. So as we introduced Marcia to you, just to let you know, Marcia's one of 650 volunteers across the Commonwealth that have taken the SHINE training, which is a 12 to 14-day training. They have to pass an exam each year to become recertified, an exam to be certified. They volunteer to counsel every week, 3 to 4 hours or more, and they have to come to a mandatory meeting once a month in Lawrence. So if you sit down with a SHINE counselor, whether it's here or a nearby town in Massachusetts, They're very, very well informed. And what I'm going to be addressing today is only for residents of Massachusetts. And I mention that because we're so close to the border. Massachusetts does have a waiver from Medicare, so we do things a little bit differently. We offer different forms of optional insurance, of Medigap plans, and of course the Medicare Advantage plans are different, and we have a few different rules within the Medicare structure in Massachusetts, and it's different in New Hampshire. So if you're from New Hampshire, you're very welcome to stay, but I'm not addressing what happens up in New Hampshire. Even though I live there, I don't do it. So one of the first things that you may have picked up after the marketplace would be the blue sheet. And next to the blue sheet, we also have your Medicare coverage choices. And this, with Medicare, you have two parts of Medicare. Part A, which covers you when you go into the hospital. Most people do not pay for Part A because you've worked 40 quarters or 10 years and you've put into the Medicare system. So you get Part A at no cost. Part B, as in boy, covers your medical services. You may think of it as all your outpatient services. Ambulance, if you go to the emergency room, that's an outpatient service because you haven't been admitted into the hospital. When you go see your doctor, that's an outpatient. That's covered under Part B. You go have a CAT scan or some other type of test. That's covered under Part B. Part B, currently for 2013, most people pay $104.90 a month for your Part B. And that's taken out of your Social Security benefit. So that if you are collecting a Social Security check, they subtract your Part B premium. If you're still working and not collecting Social Security, you're billed on a quarterly basis and you pay for your Part B on your own. Part A, which is the hospital coverage, has a deductible of $1,184. So as you can see, Part A does not cover all of your hospital. And that's when you are admitted into the hospital. You get appendicitis, you're admitted into the hospital, Part A covers you. Part A would also cover you, let's say you had to go in and have a new hip. You're in the hospital for 3 or 4 days with your new hip put in, and your doctor says, you know what, you're really doing well, but right now you're not well enough to go home, so I'm going to send you to a rehab. Medicare will pay for the first 20 days of a rehab as long as you have a skilled need. So you go in the rehab to get physical therapy so you can learn how to do the physical therapy when you go home. You can learn perhaps how to use a walker when you do go home with your hip. And for the first 20 days, Medicare will pay for that time in the rehab. If you're in the rehab for days 21 through 100, this year you have a copayment of $148 a day for days 21 through 100. So that's another kind of gap that you could say in Medicare. Medicare will pay all but that $148 a day as long as you have the skilled need, that you need a licensed person to provide you with care. Physical therapy, speech therapy, occupational therapy, services of an RN. So you can see there are some gaps in your Part A. Also, that $1,184 I mentioned, the Part A deductible, is not an annual deductible. If you are out of the hospital for more than 60 days, let's say you had your appendix taken out, and you were out of the hospital, went into the hospital on January 2nd, you were out on January 5th. you have to pay your $11.84 with just Medicare A and B. So we go into July, and in July, all of a sudden you're having a wonderful time at the 4th of July barbecue, but all of a sudden you're doubled over in pain because your gallbladder has decided it's going to go south, and you end up back in the hospital and you have to have your gallbladder taken out. So you're admitted to the hospital again. You have been out of the hospital for over 60 days. On that 61st day, then you're going to have to pay the $11.84 again, the hospital deductible. So as you can see, just under Part A, there are expenses in there that you might not be prepared or you might not want to meet on your own. Yes, sir?
Suppose that your reason for going back in, even after the 60 days, can be related back to your previous hospital.
60 days,
No
61st day,
difference.
no difference. Okay? So now I'm going to move to a minute for Part B. As I said, Part B are your medical expenses. And the Part B premium, which for 2013 is $104.90 for most people, is taken out of your premium. Everyone pays for Part B. Part B does not come to you free. It's always been written into Medicare that the beneficiaries have to pay for a portion of the cost of Part B. There's a specific formula for it. With Part B, you have an annual deductible of $147, which means January 1st, you have to pay the first $147 out of your own pocket before you get the benefit of Part B, Medicare. Just like your car insurance or homeowners. You pay the deductible, then the benefits kick in. With Medicare, the benefit after you pay your deductible, Medicare will pay 80% of the approved Medicare amount for the service, and you are responsible for the remaining 20%. And that deductible is a one-time only deductible each year. The calendar runs from January 1st to December 31st. Each January, you start over again anew in a new year. So you can see that there are gaps or holes in Medicare. The blue sheet tells you about the Medigap plans, supplemental insurance that's available in Massachusetts to Massachusetts residents. There are 7 companies that are going to be offering Medigap insurance for 2014, and they're listed on the blue sheet in alphabetical order. One of the plans that they offer is a core plan, but the first plan I'm going to talk about is the Supplement 1 plan because I think that's easier to explain. With the Supplement 1 plan, I'll give you an example. Let's say you walk out of the program today, you're out in the parking lot, and all of a sudden you just pass out and you're on the ground. And here comes Marcia to go out to her car to get her lunch. And she sees you there on the ground. She comes back in and Laura calls 911. The ambulance comes and takes you to the nearest hospital. Anna Jakes? Okay, so they take you, in an emergency, they have to take you to the closest hospital. So we'll assume, for this example, it's Anna Jakes in Newburyport. Okay, so you go up to Anna Jakes in Newburyport. You're in the emergency room. And the doctor says to you when you come to, you know, this is a good day for you, actually, because we just found out that you need to have a quadruple bypass. You know, we can save you. So we're going to put you in an ambulance. We can't do this procedure here. And we're going to take you down to Boston so you can have your quadruple bypass. So 6 days later, you're ready to come out of the hospital. And you're being wheeled out of the hospital, and your family has come down to get you and bring you home. And you're thinking, wow, I have Medicare A and B, but I've also got a Supplement 1 policy. How much am I going to owe the hospital and the doctor? Anybody want to guess what you would owe? Zero. This lady knows her stuff.
I've been in the hospital enough times.
If you have Medicare A and B and a Supplement 1 policy, you won't owe anything under the circumstances I talked about, although you may owe for your TV and your telephone.
Yeah.
That's the one thing that's not covered, okay? So you can see how comprehensive the Supplement 1 policy is. All of the companies listed on the front, they all offer the Supplement 1 policy, and all of the medical benefits are the same, no matter which company you purchase the plan from. The medical benefits for Supplement 1 are all the same. Now, I told you we'd get to the core plan. The core plan is not as comprehensive, but it still works for a lot of people. And on the back of the sheet, you can see the comparison for people with only original Medicare for Part A, original Medicare, and for the core. If you had the core plan under the example I gave, you would have to pay the Part A deductible because you were admitted into the Boston Hospital to have your quadruple bypass. So you would have to pay the $1184 under Part A because the core plan does not cover that. And we're going to move down. You didn't have to go into a skilled facility, but if you did have to go to a rehab after your quadruple bypass, Medicare would cover you for the first 20 days. So in that instance, both are equal because Medicare assumes that first 20-day coverage. Under Part B, the medical services, you would have to pay the first $147 for the year out of your own pocket. Then Medicare would pay their 80%, and then the core plan would pay the 20% as long as you had met the $147 deductible. So the core plan isn't as comprehensive, but it does still provide pretty, good coverage for a lot of people. And again, no matter which plan or which company you buy the core plan from, the medical benefits are all the same. The difference in the different companies might be that some companies may reimburse you if you, for example, if you join a specific gym. They might reimburse you up to perhaps $150 a year if you have a gym membership where they participate. They may offer you discounts if you're a skateboarder and you need to buy a helmet or elbow pads or knee pads. You may get a discount if you purchase your equipment through certain companies that have an agreement with the plan. But the basic medical benefit, no matter which plan you get from which company, it's all the same. Anyone have some questions?
Yeah, I have a comment.
Okay,
In
or a
other words,
comment.
If you've already met your deductible throughout the year, and then if you have to have surgery later that year, then it would still be, you wouldn't have to pay no deductible
Under Part B, that's right.
under Part B. But even if you have a supplement, so you wouldn't end up with a lot of bills when you get out of the
It
hospital?
depends, right, it depends on which supplement you take. If you take the Supplement 1, everything is covered, and you wouldn't have any bills when you come out of the hospital, okay? Or from your doctor,
Oh, okay,
as long as they take Medicare,
right, okay,
okay?
all right, thank you.
You're welcome. So we can always come back to questions about the blue sheet and the Medigap plans, okay? And again, this is for Massachusetts residents. It's different in New Hampshire and all of the states that adjoin us. The selections are different and the coverage is different. I think it's better in Massachusetts, but. Now the yellow sheet. The yellow sheet goes over to this side. Medigap plans. I'm sorry, Medicare Advantage plans. I have to wake up. I didn't drink all of my coffee this morning. Okay? We're going to be looking at the side of the yellow sheet that says Essex County, because my program covers both counties. And it's easier for me to have both counties on one sheet, because then when I grab for the yellow sheets, no matter where I go, I know I've got the right thing. The yellow sheet on the Essex County side offers what are called Medicare Advantage plans. And they're HMOs or PPOs. HMO, Health Maintenance Organization. A PPO is called a Preferred Provider Organization. If you choose to go with a Medicare Advantage plan, you're going to look at the Essex County side, and as long as you're a resident of Essex County, you can join any of the plans in the top boxes. Again, they're listed alphabetically. Starts with Blue Cross, Fallon, United Healthcare, and Tufts. There's a different, quite a large selection under most of them. In Essex County, United Health is United Health, which offers the AARP plan, only offers one plan in Essex County. I'm going to describe to you how the Medicare Advantage plans work. Medicare gives, let's say we have ABC HMO, that someone decides to become a member of ABC HMO. Medicare gives ABC HMO a specific amount of money each month to take care of their members who live in Essex County. So just for my example, I'm going to say Medicare gives ABC HMO $700 a month for each of the members that join ABC. In addition to that $700 a month, if you join ABC HMO, they also get your Part B Medicare premium, which is currently $104.90 for most people. So that would also go to ABC. When you go to see your doctor, if you have an HMO, you pay a copay. So that would go along, the doctor would get your copay. If you have to have tests, there's also copays or deductibles. If you go into the hospital with an HMO, there are copays or deductibles along with it. But since you've joined ABC HMO, you agree to abide by their rules. Now, ABC HMO gets the money from Medicare and your premium to take care of you and the copays and deductibles. When you join a Medicare Advantage HMO, you agree that you will use a doctor who has a contract with ABC HMO, that your primary doctor will have a contract, will accept ABC HMO members. If you need to see a specialist, you're agreeing that you will go to your primary and get a referral to see the specialist. And usually you will get a referral to the specialist within the network or group of doctors that your primary refers people to. So if you go to see your primary and you're a member of ABC HMO and you're having problems with your knee, and you say to the primary, well, I've got knee problems, and the primary says, oh, okay, I'm going to send you to Dr. Smith, who's an orthopedic doctor, and he's, just a couple of blocks down the street, I'll give you a referral to see Dr. Smith. And you might say, oh no, I want to go see Dr. Jones in Boston because Dr. Jones fixed my brother's knee and did a great job. Well, your primary would probably say, no, I'm going to give you a referral to Dr. Smith because we have an orthopedic specialist here who knows about knees and can help you. So you decide, well, I'm going to go to Boston and see the doctor I want to see. So you go in, you make an appointment, you arrive there, and the person at the front desk says, welcome, blah, blah, blah. Can I have your insurance information? So you show your ABC HMO insurance card, and the person at the desk says, well, we don't have a referral from your primary doctor. And you say, well, my primary doctor didn't give me a referral to see you. He gave me a referral to see Dr. Smith up in Essex County. And the front desk person says, well, you're going to have to pay for this if you want to see Dr. Jones because you didn't get a referral and we don't participate in ABC HMO. You would be responsible to pay out of your own pocket for that visit. Medicare cannot be billed because Medicare gives ABC HMO X amount of money every month to take care of you, and when you signed up for ABC HMO, you agreed to abide by the rules. Now this type, Medicare Advantage HMO, works for many, many people, but I want you to understand how it works so you know the difference. So with the HMO, a Medicare Advantage HMO, you have to make sure that your primary doctor accepts that specific HMO that you want to sign up for. And if you need to see a specialist, you need to get referrals from your primary to see specialists. If you have an emergency or urgent care need, and say you're down watching the World Series at Fenway or watching the football game in Gillette, and something happens and you have ABC HMO, they will take care of you if you go to a nearby hospital for emergency. They will take care of you if you're out of the area for an emergency or urgent care. But just for regular care, you would need to get a referral from your doctor if you go outside of the network. Now, I mentioned there's also a PPO, and you can see under it says type of plan. Now, most of them are HMOs. There are maybe 4 PPOs. The PPOs give you a little bit more flexibility. With the PPO, you can have your primary care doctor, and you could go see your primary care doctor and get referrals within the network. But if you wanted to go see that orthopedic doctor in Boston and you had a PPO, you could call the Boston orthopedic doctor and say, I have XYZ PPO. Will you accept it? And if they say yes, then fine. You go in, you show them your card, and you will still have a copay because the Medicare Advantage plans have copays when you go to see your providers. You would pay a higher copay if you go out of network with the PPO, but it gives you the flexibility to go out of the network if that doctor accepts the PPO. You pay a little bit more for all of your services, but you do have a little bit more flexibility to go out.
Are these plans on the yellow sheet here?
Mm-hmm.
Is that in place of or in addition to the supplement one that you spoke about?
Let's refer back to the white sheet. One of the key words on the white sheet is or. One or the other. You don't need both. You don't need either. There's no law that says you have to sign up. but this is what's available to you that will work with your Medicare if you want more options for your coverage. You could stay with Medicare A and B only, but you understand from what the A and B deductibles, co-pays, co-insurance would be. It's not, Medicare by itself does not pay 100% of your costs. Now, if you choose to go with a plan on the yellow sheet, a Medicare Advantage plan, your drugs, your prescription drug, your Part D, as in David, prescriptions are wrapped into this sheet. You can see again on the next to the last column, drug benefit. It says yes in all but 4 of the plans. So if you decide to go with one of the plans on the yellow sheet and you need to have drug coverage through Medicare, you choose one of these plans. The only way you get your drug coverage is through this plan. The only exception being if you're with the Veterans Administration and you get all of your current medications through the VA, you have what they call creditable coverage. But if you select a Medicare Advantage plan and you want drug coverage, prescription drug coverage, under Medicare, the only way you can get it is through the plan you join. And you want to make sure it has a drug plan. The Medigaps on the blue sheet do not come with a medication or a drug plan. And we'll talk about how you can get a drug plan, a separate drug plan that will work for you if you select a Medigap plan. Any more questions about the yellow sheet? Okay. So now we can start to talk about Part D coverage. Part D coverage is only for prescription medications. It's for prescription medications. After you go and see your doctor, he writes you a prescription, you go to your local drugstore. If you're in the hospital or in the rehab and you're getting medications, that's covered under Part A. So the Part D coverage is only for your prescriptions. So you go down to your local drugstore and you get your prescriptions. It's covered under Part D. If you have a Medicare Advantage plan from the yellow sheet, it comes, your prescription coverage comes wrapped up in that plan. So now we're talking about folks who may join a Medigap plan or who have just decided to stay with A and B for whatever reason. You want a prescription drug plan. The way the Part D coverage for the prescription drug plan works, this is the standard Medicare landscape of a Part D plan. For this year, for 2013, the plans can have a yearly deductible. It is limited to $325. Some plans have a zero deductible. They may have a deductible for the year of $150, but it cannot be more than $325. After you reach the $325 deductible, if you have one, then you go to the drugstore, and I'm going to use an example, and I don't like math, so I'm going to use a very simple example that fits my brain. We'll say that you have a brand name drug, and it retails for $100. You have your Part D plan. You go to the drugstore, you're at the pharmacy, you show the person at the counter your Part D card, and they say, oh, okay, your co-payment today for that drug is 25% of the cost of that drug, which would be $25. So you pay the $25 co-payment, that's called a co-payment, for your medication, and your Part D plan covers the other 75. So to get towards the initial coverage limit, which you see down here for 2013, of $2,970, that whole $100 amount is counted to calculate till you reach the $2,970. Does anyone know what happens or what it's called when you reach the $2,970? The donut hole or the gap. And when you fall into the donut hole, you don't get a gift card to go down to your local Dunkin' Donuts. When you fall into the donut hole, when you reach that $2,970 amount, which is what you and your Part D plan have paid towards your medications, you fall into the donut hole or the gap. And this year and next year, you have to pay 47.5% of the cost of that brand name drug, which would be $47.50. One of the things the Affordable Health Care Act is doing is that it's slowly doing away with the donut hole. So by 2020, there will be no donut hole. Prior to the Affordable Health Care Act, you had to pay 100% when you reached the donut hole. So the Affordable Health Care Act has already is helping out with the donut hole, because 3 years ago you would have had to have paid the whole $100 if you were in the donut hole. Prior to 2006, before Part D even came into existence, there was no coverage for prescription drugs unless you might have had a retirement plan or been with the VA, something like that. But for most people, there was no coverage for prescriptions prior to Part D coming in. So once you're in the donut hole and you're paying the $47.50, if you get up to what they call the out-of-pocket threshold, which for this year is $4,750 that you pay out of your own pocket, then you fall into what's called catastrophic coverage, and you would pay no more than 5% for the cost of that medication, for that brand name medication. The generics are, you pay less. That is how the standard Part D plan works. That's the way the landscape of the Part D plan. And as you can see for 2014, the figures are a little bit different. But basically, that's the formula for the Part D plan. This is the time of year when you can make changes to your Part D plan. You should review your Part D plan, your Medicare Advantage plan. You want to review even your Medigap plan to see what plan would offer you the best deal for your circumstances. Many people received, if you have Blue Cross, MedX, Bronze, or Core, you received a letter from them at the end of September, and they gave you some good news. It went down, that's right. Your monthly premium went down if you had Blue Cross, the supplemental Medigap plans. All of the other plans also sent you what their premiums and their coverage would be for 2014. And I know from experience that there are many people who got these big magazine-sized envelopes at the end of September from their health insurance plans or their Part D plans. And you know what? Here, I'm going to put it right here next to my chair, or, oh, I'm going to put it over here on the dining room table, and I'll get to it. And you know what happens? Here's the dining room table. And just, here's the easy chair and the table. Oh, I'm going to watch Bones on TV tonight, or CSI. I'm not going to, that's boring. I'm not going to look at that. You need to open it and look at it, because your plan has been kind enough to tell you what they're going to do, what changes they're going to make for January of 2014. You really need to open it up and look at it, because you don't want to be surprised when you go to the drugstore in January. You haven't reviewed your Part D plan, only to find out the drug that was covered in 2013 is not covered for 2014. They played by the rules. They sent you that information, and you decided to do more fun things instead of reading it and looking at it. And if you didn't understand it, you only have to call down here to the center, the Council on Aging, and say, you know what? I need an appointment with Marcia. I'll bring her the kind of coffee she wants, but I need to see her. And you come in, you bring all of your stuff, and you sit down with Marcia, and she can explain it to you so that you will know what's going on. Yes?
I moved from New York to Massachusetts in July. I got a notice from Humana Part D, and it said, well, you're out of here. So they said, you have 2 months to sign up
For a new plan.
for a new plan. So I called Humana Part D and said, I want to sign up for the Massachusetts plan. They took all the information, and they said, you have to have a deductible, da-da-da, da-da-da, da-da. And I never got anything. I called back, I wrote letters, nothing.
So you never formally enrolled in a plan, it sounds like.
Apparently not.
Okay. If you move to a new state or to a new area, you do have a 2-month window where you can enroll in a new plan. What you could do, if you're under the impression that you actually enrolled in that plan with Humana for Massachusetts, do you have an idea of the date that you called them?
It was within the 2 months.
Okay, because they usually record or they keep track on the computer of calls that came in. So you might call them back, and if you can kind of narrow it down, say to the month of July or August, that you had called, and it was on a weekday, let's say, and if you remember, was it morning or afternoon, they should be able, I believe, to look up, even just with your name, do a cross file, and pull up that recorded conversation and play it and say, you know what, we told you about it, but you didn't enroll. Or, gee, yes, we did enroll you, but something happened. You want to do that. But right now, you have between October 15th and December 7th, you can enroll in a new Part D plan. You can enroll in a Massachusetts Medigap plan or a Medicare Advantage plan, whatever suits you. And one way that we can really help you with anyone's decision, or just to review, if you say, oh, you know what, I'm really happy with my plan, my Part D plan, but I didn't open that, and even if I open that thick booklet, I can't understand what they're saying. If you would like us to review Part D plans for you, if you take this bright yellow or gold paper, if you have a spouse at home, one for each of you, you fill out both sides, return it to the address on the back, which is our regional office in Lawrence. We will enter your information at the Medicare.gov website, or if you're comfortable on the computer, you can do this yourself. You just go to Medicare.gov, when the home page comes up, you click on to the little yellow tab, on the left that says Health and Drug Plans, and that will take you to the program where you need to give them your information. If we do it for you, we will send you back the top 3 Part D plans that cover your drugs, the medications that you take, and are the most cost-effective for you. There's no charge for this, and it's confidential. We don't tell anyone else what we did for you. Sir?
If you do this on the computer, like you said, you can look at the different plans and see figure out which of the different plans is best.
Best for you, that's right.
And would that be updated as of next January? Or
No,
would it
it's
be as of
updated now
today?
for January 1st.
It is.
Yes.
So
You could do both years,
if I
2013 or
log on
14.
now, I can look on 2014.
That's correct.
Well,
Yeah.
I guess my second question is, I've been on this for 2 or 3 years
Okay.
already since they started the Part D.
Right.
And I fall in the donut hole about October each year.
Okay.
And the reason is insulin.
Right. Insulin's very expensive.
There doesn't appear to be any such thing as generic insulin. Is that a true statement?
I don't know. I'm not a doctor or a nurse. I can't answer that question. I don't know. But you know what? In Massachusetts, we have a program that is called Prescription Advantage. Anyone in here know about prescription? This lady is going to give Marcia a run for her time.
When I tried to remove it.
Well, are you a veteran? No. Okay. If anyone's a veteran, you should really talk to your veterans agent here in town. Laura can probably tell you who it is and make an appointment with the veterans agent.
It's Kevin White.
Oh, Kevin White?
Kevin Hunt. He's just
Kevin Hunt.
Yeah, he's just fabulous.
And is he at the town hall, Marcia, do you know?
Newburyport.
In oh, they share.
They share.
Okay, they share. And he may come, do you know, does he come down here to have hours? Or over here?
Not that I know of. He has hours in the Newburyport Town Hall.
Okay, but if you need the veterans agent, call Kevin Hunt in Newburyport. Hunt. Okay, Prescription Advantage. Like this gentleman said, in October, you fell into the donut hole. Now, for many people, Prescription Advantage is going to help you if you fall into the donut hole. It will give you a lower copay for your medications.
Excuse me, Susan, you don't have it in your packet.
Oh, I'm sorry. No, you don't have it in your packet. Marcia does have, we do have applications and information available here at the senior center. I'm sorry, I just didn't want to carry more than I had to, more than I have already. But they are here if you want information about Prescription Advantage. Prescription Advantage is a plan offered by the Commonwealth of Massachusetts solely for residents of Massachusetts. It is an income-driven, you have to fall within certain income limitations. However, it does not count your assets. You could have $100,000 in a savings account, and Prescription Advantage does not count the asset. It would, however, count the interest that you derive from that $100,000, which these days, unfortunately, doesn't amount to much. If you get a 1099 for something, that's income. If your bank sends you a 1099, your IRA, if you get a 1099 for something, that is income. That is what is counted. If you take a disbursement from your IRA or a 401, 403, that's income. That would be counted. But the principal you have in your IRA, 401, 403 is an asset, and that is not counted or considered by Prescription Advantage. Okay? I'm going to give you the top income limit for single people and a married couple so that you could join Prescription Advantage and it wouldn't cost you anything to join Prescription Advantage except for the postage it takes to mail the application to Worcester and the time it takes you to fill out the application. Okay, so for a single person, the top level of income without having to pay for Prescription Advantage is $2,873 a month. That's for a single person. For a married couple living together, the top monthly income limit is $3,878 a month. If you're a couple living together, household income is counted. You're married, you live together, both incomes are counted. You're living together, you're not married, you're single. Okay?
Does that include Social Security?
Yes, sir. You get a 1099 for your Social Security. Okay? So if you're in that top S4 income category and you fell into the donut hole, and let's say you had to pay $88 for a 30-day supply of your insulin while you're in the donut hole, if you had Prescription Advantage, you would pay no more than $30 for a 30-day supply of that same insulin. You need to have a Part D plan either through your Medicare Advantage plan on the yellow sheet or a Part D plan in order for Prescription Advantage to work. Prescription Advantage supplements the Part D plan. It is not a Part D plan. It helps you. So that there are many people who fall into the donut hole, and this, I think, has a very liberal income policy. And it will help you. Yes?
Say, we'll use this gentleman here who takes insulin, and it's very expensive.
Yes.
Just say it's $400 a month, because I bet you the retail amount for insulin is about $400 a month. And
Yeah.
he has the a Medicare Advantage plan.
Right.
So after 7 months, we'll just say we're rounding
Right,
it out.
sure.
On the 8th month, his Medicare plan, maybe his Advantage plan was charging him maybe $50 a month.
And he
So-
falls into the donut hole.
He now goes into the donut hole. He still technically has coverage under probably his Medicare Advantage plan, but the copay is lower on Prescription Advantage. Would that kick in? Is that how we?
Yes.
Okay.
Okay, what you do, if you become a member of Prescription Advantage, you show your Prescription Advantage card along with your Part D card when you make a purchase at the drugstore for your prescriptions. Prescription Advantage is not billed per se, when you start off on January 1st, but they're notified that you are making purchases so that they can keep track of where you are. Okay? So it keeps track of where you are in the donut hole, but you have to present the card.
Does that only come into play when you reach the donut hole and not before?
Well, there are other benefits of having Prescription Advantage. I do want to say the figures I gave are for people over 65. If you're disabled and under 65 and on Medicare, there is a different income threshold for people to meet. The other benefits of Prescription Advantage. If you're a Prescription Advantage member, and let's say all of a sudden in March, you decide, the plan I have is not working for me, my Part D plan or my Medicare Advantage plan. Just doesn't seem to be working. I'd like to change. If you're a member of Prescription Advantage membership gives you what they call special enrollment period outside of this time, the October 15th to December 7th time frame. You can change your Part D plan, or you can change, and if you change your Part D plan and you have a Medicare Advantage plan, if you enroll in a regular Part D plan, go back to Medicare, it gives you the ability to do that. Whereas if you didn't have Prescription Advantage and you sign up for a Medicare Advantage plan and it starts in January and all of a sudden we're in March, you cannot change your Medicare Advantage plan. But if you have Prescription Advantage, you could. You could also change your just standalone separate Part D plan because you're a member of Prescription Advantage. It gives you that flexibility that you wouldn't have. Also, with Prescription Advantage, it has what's called an annual out-of-pocket spending limit. And if you were at that S4, that level of income that I mentioned, once you spend out of your own pocket $2,515 during the plan year, and again it runs January 1 to December 31st, if you met that $2,515, for the rest of the year, Prescription Advantage would pay your drug copays. You would have to continue to pay the monthly premium for your Part D plan, but Prescription Advantage would pay for the copays of your drugs. Now, there's also one other higher income category for Prescription Advantage, and it works differently for people who are in this income, and I'll give you the range of the income. I'll start off with a single person. The monthly income range is $2,874 to a limit of $4,788. That's for a single person on a monthly basis. For a married couple living together, the range of income on a monthly basis would be $3,879 with a top of $6,463. If you're in that income range, Prescription Advantage works a little bit differently. Once you spend out of your own pocket $3,355 during the year, then Prescription Advantage will take over and pay your copays for the rest of the plan year. So if you're in the S5 category, you really have to weigh if it's going to be cost effective for you to join Prescription Advantage, because it would cost you $200, an annual enrollment fee, to join. If you're a member of a couple and only one person wants to join, then one person would pay the $200 because maybe it's more cost effective for that one person to have the coverage, and the other person only takes a couple of generic drugs and will never meet the 33. To give you an example of how important this S5 category is, there are, I believe, 3 or 4 people across the Commonwealth who fit into this. Well, there's more than 3 or 4 who fit into the category, but 3 or 4 who decided to become members because they have one drug that costs $11,000 a month. So is it worth it to them to join Prescription Advantage for $200? Because after January, it's not going to cost them anything except the premium for their Part D plan, the monthly premium. So that's why I said with the S5, you have to balance to see if it's going to be cost effective for you. And there are some people who'll pay the $200 and say, it gives me peace of mind, I want the coverage. Maybe I'm not going to use it, but I want to know that I have the coverage. You know, you can do that.
I have a question.
Sure.
I have, a lady called me yesterday. She's in her mid-80s.
A friend?
Yeah.
Yeah.
And she said that, you know, she was going down to the drugstore to get her asthma medication. And I said, oh, do you have a prescription plan? No. She said, what's that? And I said, well, I'm pretty sure that everyone is supposed to have a prescription plan.
A Part D plan, right.
Is that correct?
Kind of. And I'll tell you why I say kind of. Because it doesn't say that it's mandatory, but if you don't sign up when you're initially eligible for Medicare and you don't have what they call creditable coverage, maybe coverage through the VA or coverage if you're still working, or coverage through a retirement plan, if you don't have creditable coverage, then you will be assessed a penalty if you did not enroll in a Part D plan.
Find out that she doesn't have.
Well, they wouldn't find out that she doesn't have it until she goes to enroll in it.
Oh, all right.
Okay? So if she decided, oh, I think I will find out about this.
Well, I encouraged her to.
Yes. Then they'll go back and let's say, I think you said she was in her 80s? Okay. Part D started in 2006. And by May 15th of 2006, if you were eligible, that's when it started. So she would, the penalty is 1% for every month that you didn't enroll and you could be enrolled. So just for the sake of discussion, I'll say she might have a 72% penalty. 72. 12 times at least 6. Maybe it's probably 7 by now. But 72 is stuck in my mind. So 72% of what? It's 72% each of the annual benchmark price of a Part D plan. The average national amount for the 2013 of a Part D plan, which this year is $31 and I think 17 cents. So for each percent, she would have to pay 31 cents. So it would be 31 times 72. Now that's going to be added on to the premium of her Part D plan each month for the rest of her life. The 72% is going to stay the same. But if the average cost of a Part D plan goes up, as an example, because I like round numbers, to $40, then it would be 72 times 40 cents. So the amount can go up, the cost amount can go up, but the 72 would stay the same. There are, the federal government does offer what's called extra help or limited income subsidy, and if you're eligible for that, and Marcia can tell you more about it, or if you wanted to inquire about it on your own, you could call Social Security or go online to ssa.gov and apply for the extra help. If you wanted to, I can send you an application for it in the mail. And if you fit into the extra help categories, you could, or she could, have that penalty paid for by the federal government, and maybe all or part of the monthly premium, as well as the co-pays and deductibles would be lower. So that's another program that's available to help with the costs of the Part D plan. It does have income and asset limitations, but I'd be happy to. SSA.gov, Social Security Administration.gov, GOV. Did I cover everything about Prescription Advantage?
So only the question you might want to address is if you run into something long about it in March or April.
Oh, right.
you apply
Yep. That's right. So if some of you go home and say, you know what, I'm going to apply for Prescription Advantage, but I fell into the donut hole in April or May, so maybe it's going to help me now. If you apply for Prescription Advantage today, and you can start your application by calling them, and I'll give you the phone number. They'll start your application on the phone. If you do receive membership in Prescription Advantage, you'll get your letter. Dear Mehitabel, congratulations, your Prescription Advantage coverage starts December 1st, 2013. Please send us copies of all of your explanation of benefits that you received for your Part D. Now, if you have Part D, either a standalone plan or with your Medicare Advantage, you get a letter, more than a letter. You get documents every month telling you for the previous month what you bought for your medications, what meds you bought, how much you paid, and how close you are to the donut hole, and it gives you lots of information. So Prescription Advantage is going to say, please copy and send us from January 1st all of that information. So you come down here to the Senior Center and they copy all of that for you. You send it to them. And you fell into the donut hole in April. Prescription Advantage is going to look at everything, compare all the documentation, and they're going to say, well, Mehitabel, you fell into the donut hole in April, and for that $100, or for that medication that you were paying $88 for, with your Prescription Advantage membership, you should have only paid $30. They're going to give you back the difference. They're going to send you a check for the difference from the time that you fell into the donut hole based upon what you paid and what you should have paid, the difference between your Prescription Advantage copay and what you were paying. And that's for the S up to the S4 category. So that if you feel that this would help you because you're in the donut hole already, call them. The number is 1-800-243-4636. 1-800-243-4636. And you're going to have one of those irritating voicemail menus. If you have a press tone, press the button telephone, press the number 2. Or you can actually say 2, just like when I was a kid and I picked up the phone and the operator said, number please. You can still say 2, and they'll understand you and they'll connect you to a customer service representative at Prescription Advantage who is a very nice person. And they will help you get started on your application. If you want help from Marcia, call up and make an appointment. But they will start to take your information. They will tell you, by law, we have to have your original signature on the application. And they also may need other documentation. They will tell you what they need. By law, they have to have certain information. If you don't provide that information, you're not going to be admitted into the program because it's funded by the Commonwealth, and the Commonwealth has rules and regulations as to the way and the type of information they need for your membership to be determined. Excellent program. It's not available in other states. It will help you tremendously. Look into it. Apply. If you're not eligible, nothing bad's going to happen to you. But try it and see. Any questions? Okay, I thank you all for coming today. I appreciate your time. You're welcome.